A large new study finds adults diagnosed with ADHD live shorter lives than those without a diagnosis. That's according to a new study published just this month in the British Journal of Psychiatry.
The study found that men with ADHD were dying roughly 7 years younger and women were dying about 9 years younger. So here to talk a little about why that might be happening is 9 News health expert Dr. Payal Kolhi. Dr. Kolhi, good morning.
Good morning. Alarming numbers, right?
Absolutely. So has ADHD been increasing in previous years?
It really has. If you look at the prevalence over the last few decades, we're getting better at diagnosing it and picking it up. So that's one of the reasons that more people are being diagnosed. In fact, they say about 9 to 10% of children in the United States under the age of 18. So about a 10% chance of your child having it, 4 to 5% of adults. But we think that the screen time, the social media, all the scrolling that we're doing is actually increasing how much ADHD we're having. We're also thinking there could be linked to exposures in our food that might be changing the way we think about attention and ADHD.
So why and how did the authors decide to do this study?
Well, it's interesting. It's been a growing body of literature. So for a long time, we've known that if you have ADHD, your quality of life is not as good. But about 5 years ago, there was a study in kids that showed that maybe the quantity of life is also affected. In fact, kids who get diagnosed with ADHD are more likely to have chronic health problems, 13 different chronic health problems as adults, including diabetes, high blood pressure, high cholesterol, being overweight, and this might affect their life expectancy. So the authors decided to look at this large study in the UK. They took about 30,000 adults with ADHD, compared them to about 300,000 normal adults. And the numbers are alarming. I mean, you're talking 7 to 9 years impact on life expectancy if you have ADHD.
Okay, I just admitted that I have ADHD, severe ADHD actually. And I'm curious though, kind of if you can elaborate a little bit more about what is the link between ADHD and the lower life expectancy here?
Yeah, so initially we thought maybe it's the medications, right? Because they're stimulant medications, maybe that's what's causing it. But that's actually the opposite. The ones that take medications have a protective effect. So we think it's the behavioral issues associated with ADHD because they found in the study that patients who have more impulsivity, lower education, less sleep, they just tend to be more hyperactive, they tend to have an even lower life expectancy. So we think that people with ADHD are not taking care of their chronic problems. They're not going to the doctor as much. They're not as financially stable. They're not as plugged into healthcare. And to me as a physician, this really puts a spotlight on a huge modifiable risk factor for death. Because we're so busy telling people to control their heart disease, their diabetes, their high blood pressure, we don't actually screen for ADHD. And if they have ADHD, they don't know how to control those factors as well, and it can increase their risk of dying.
Well, as a mom, this scares me. There's such high rates of ADHD in kids. What can we do to maybe lower those rates?
Well, I would say a couple of things. So first, as you said, Corey, we need to target the root causes of ADHD, which largely we're realizing are behavioral. So really putting limits on that screen time, taking those what I call digital detox breaks, having a day in the week where your child is not on any kind of device whatsoever. That's important to address the root cause and sort of recondition your brain. But if you do have a child or even an adult in your life who has ADHD, really trying to understand that you can modify their risk of dying by helping them to be better organized, plugged into their screenings, making sure they're staying on top of their health care, because that's often what falls through the cracks when it comes to these types of individuals.
We're out of time, but can you just really quickly tell me if ADHD can be reversed?
So ADHD, there's a growing body of evidence that even though it's driven by a chemical imbalance, it's kind of mind over matter, you can do top-down things because such a big component of it is behavioral. So it's not all about chemical imbalances. A lot of it is about behavioral and sort of rewiring how you behave. So that is promising.
Good to know. All right.
Interesting. Dr. Kolhi, thanks for coming in.